Hello, and welcome to another episode of Right Brain Rounds. And today I have the pleasure of introducing Dr. Sapna Shah-Haque. She is a physician, family medicine in Kansas, and she's also an MBA grad. And I've been able to talk with her before on her podcast called The Worthy Physician. And it's all about ways to kind of look at your worth as a physician. And she talks with so many awesome people on her podcast, just about, the things that we need to bring to light in the medical field on how you can, get over imposter syndrome, feel like you are enough as a physician, and a lot of other things that I'll let her talk about. But thank you so much and welcome.
Thank you very much. It's a pleasure to be here.
So I am really interested. I know that you were born in Kansas. Um, you're, are you in your hometown?
I'm not. I'm about
Okay.
45 to 50 miles south. So
Okay.
I didn't move very far.
Okay. And you're all about community and, everything that I've ever, spoken with you about and giving back to your community. And just tell us a little bit about how you got started in the field of medicine and how you've progressed to having a podcast and really being a big influencer in the world of medicine and helping physicians champion for themselves.
Sure, thank you for that.
Yeah.
Uh, Going into medicine was not really at the top of my list as a young adult. I would say one of the biggest things was I never wanted a desk job. Having said that, I started out engineering, and when I had a couple of circuits that actually smoked because the chips that I put in were wrong, because they were put in the wrong drawer, what have you, I just realized I didn't care. I thought the smoke pattern was beautiful, but I really didn't care about the circuit. So to me, that was a sign to change something. So I actually dropped my classes. I withdrew and I gave up my scholarships for for engineering, and
Oh,
I
wow.
it just wasn't wasn't a did not feel right. So
Mhm.
if it's not something that feels right for me, I'm not going to do it. Why go down that path? So my husband and I were dating at the time. He goes, "Well, what have you thought about doing?" And we went through different things. Being a doctor, I guess but I'm afraid of I'm afraid of blood. I mean, it had been on there, but it wasn't at the top of my list. And he
Mhm.
goes, "Well, let's go work around sick people." So we got a job in the hospital, and I really enjoyed being around sick people because, I choose to be there, they don't. And I really fell in love with the elderly population, so, 65 plus.
Mhm.
And I got a job as a phlebotomist to overcome my fear of blood. And the rest is history. Applied to medical school and got in, decided to pursue internal medicine as my residency. And I have looked back, and I think I would make the same decision again most days. There's some days when I think we all ask ourselves, why did I put myself into this situation? But overall, regardless of what corporate medicine tries to make us think or feel or projects, we have to remember that being a physician or being a healer really is a a career or a way of life really tested through time, and it's one of the most noble professions. It's more of a profession. It's one of the most noble professions, I think, up there with teaching. So that's how I came into medicine, and why I've stayed is because through, you know, I graduated from residency in 2013, but I've had my bumps. I haven't really met anybody who hasn't. And in 2016, I went through burnout, moral injury, didn't have the words for it, and it wasn't until 2019 when my best friend from medical school and residency died from suicide in her office. And her letter outlined the reasons why she didn't get help. And it was because she was afraid of professional repercussion that I started reading, why would a physician take their life? Not that money or a career are protective, but it's like we have the ability to impact so many lives. But I started reading and I didn't realize the statistics of how many physicians die by suicide, from suicide every year. That was pre-COVID. I didn't realize the burnout rate, the statistics of female physicians dying from suicide is much higher than men. And to me, that was appalling. Not that I'm not judging anybody, but the question is why? Why would that happen? And what in the hell is being done to prevent that? And there's no there's no literature about. I'm not laughing because it's funny. I mean, I'm frustrated that there was no literature about what was being done to prevent that. I mean, if a senator ends up in the hospital for a very routine medical issue, it makes headline news. When a physician dies by suicide, from suicide, I'm sorry, I'm not really up to date on what the most politically correct way to say it, but it's made to appear like it was the physician's fault, like they weren't strong enough, like they weren't resilient enough. That's utter BS. When I read that, when I started reading this, I had words to describe what I was feeling, and it also made me understand that it wasn't my fault that I was feeling burned out in 2016. Mind you, I could have handled it better. I could have coped with it better than isolating myself, but I think it's more of a phenomenon now that we're talking about it. It's more mainstream than what it was back in 2016. So what happened with the podcast was during, you know, during my time of reading and during my time of really when it got to the 1 year anniversary, I did not know how to process that. So I went to see a therapist and I started working with a life coach. And I'm very open about that fact. But I started to find my words and I wanted to use my voice as a way to help to normalize the conversation, help to bring forth these pain points. And so the worthy physician was born.
And isn't it sad that it had to be that way? I mean, I'm glad that it's out there and you're helping other people in putting these things out there, but what did it take to get you to that point where you said, hey, I have to speak out about this? I mean, it took the death of your friend, and a medical culture that is toxic.
Yeah. It's changing slowly, but things in medicine don't change fast enough. I mean, it's like a glacier, it's like molasses. And yeah, you're right. The expense the medical community has had to pay in order to bring these things to light is just disgusting. Because if this were to happen in any other industry, I'm pretty sure it would be addressed very quickly. But I keep asking, how did we get ourselves here? Though that's not within my bag of answers. I'm an advocate for each doctor raising their voice and standing up for themselves. You can do that diplomatically without um, being rude, without being aggressive or hateful. But sometimes, if that's what it takes to stand up for yourself, then so be it. Because the more that we say yes to things that aren't truly in line with our values or our true selves, it kills us from the inside slowly.
And sometimes people are afraid to speak out, because then they're calling attention to themselves, and then it's a beacon of, possible failure. Like they couldn't hack it. They couldn't, take the stressors of a career in medicine. They're shamed, right? That's the culture of medicine, is not to speak out and say, hey, actually there's something wrong with me. I need help. That's
Yeah.
not looked upon in a favorable light. you know More so these days, people are asking for help. I think that because, as a society, we're talking about it, but, you know, statistics don't lie, and it's still happening. So, where is the systematic error here that needs to be corrected?
I think that first of all, to address the culture of medicine, and that is from the top down. And I know that when I talk about this, I get pushback. You're asking about one of my favorite episodes, or I'll tell you, I just had that talk with Dr. Bradley Block,
Mhm.
and we were talking about autonomy. But one thing that a good point that he brought up, and I agree with that 100%, is to be active with your professional societies at the local level, which would be probably state level and national level if possible. Also, get out and vote, get to know your congressman or woman to help bring about that change. Again, it's slow. Nobody likes change, particularly when medicine is seen as a lucrative business. But let's also be honest, it's not ethical to put money and profits before patients. So one thing is you can advocate for yourself at the point of being active in your medical society, your professional societies, and also voting. The second thing is, we also forget we don't necessarily have to jump up and yell to make things known or to advocate for change. It's not always the one who screams the loudest that is correct or that is right. So it can be as simple as creating a microculture. What does that mean? It means that with your tight knit work group, assuming that you have one, ideally to thrive in an environment, you should have a tribe. First step is to create that tribe. Second thing is to kind of have social norms within to create that microculture. So it helps to make that work environment more tolerable, more palatable. That is one way to thrive in a very broken system. Another thing would be to get active in your medical committees. And I know that, okay, we're sitting here talking about burnout moral injury, so why in the hell would I want to get involved with another committee? And I would say you don't have to. But let's say, hey, can I switch from this committee that I absolutely abhor to one that I actually would love to be involved in? So it's making a switch.
Mhm.
These are just some ideas to start. Another thing is if you're miserable, what is that doing to you internally? I mean, if you were advising a patient, what would you tell them? And then the next step is to treat yourself with that same compassion and allow yourself to be human and listen to your own needs. And if your basic needs of feeling safe at work, as silly as it sounds, it is one of the basic needs. If you don't feel safe at work, if you don't feel psychologically, physically safe at work, then maybe it's time to turn in your notice. You can always sell the house, you can always downsize, you can always move to an area of lower cost of living if it means your sanity. And for those that think that you're a failure, they're they're not paying your bills, they're not holding your hand, and quite frankly, they don't give a damn about you. So why should you give a damn about what they think? And honestly, it's not true that you're a failure. You're a human being who, this is a normal response to an abnormal situation. So really listen to your body, listen to your mind, listen to your soul, and allow yourself to really dig deep. I think that's where a lot of it becomes uncomfortable because you have to acknowledge that something's not right. You have to acknowledge that, okay, when I became a doctor, maybe this is not what I signed up for. Well, what does that look like? And it doesn't mean that you're a failure. It means that the system is absolutely messed up and no human being can really thrive in that type of environment. 100%. We're not robots. Now, there are ways to thrive, but what works for me is going to be different than somebody else. But I had to identify what I needed in order to make this career sustainable for myself.
I also think that having the confidence to move forward in your truth of what works for you um, is important too, because I know, like, if I could use myself as an example, going into a community where I said, you know what, I'm doing what I do as a maternal fetal medicine specialist, but I don't do deliveries. In a very, I mean, we're removed from the lower 48. We don't have a lot of resources here. But how could I potentially see all the other patients and be on call to do deliveries? And it just, saying that, putting it into motion and actually doing it, feeling like I was disappointing people, getting over that, fear of, and this is just a specific example of what other people might think of what you have decided your career will look like. How is my life going to look like? I'm going to do this. Thank you very much.
Oh, exactly. I mean, I think
Mhm.
that's correct. We got to where we're at because we people pleased, right? The attendings, the professors, the admissions committee. So that's why I say, a lot of this plays to the traits that help to get us here, but at some point they become maladaptive. And it's okay if somebody else that is out here in the periphery, that is like not in your inner circle, not one of your, say, trusted friends, trusted family, trusted advisors, right? It's okay if they're displeased because you can't please everyone. And at the end of the day, as cliche it is, the song goes, you can't please everyone, so you've got to please yourself. And that's where I think shifting the mindset of, okay, this is my life. Being a physician or this profession is only a part of it, right? We're not, maybe some are married to their career, and that's fine, but I'm not. And I have kids, and I like to do other things outside of medicine. And so, what I want my life to look like is being a physician is part of it, but it's not all of it. So, each person has to kind of come to terms with that. And I think giving yourself that permission, if you need that permission, I think this conversation definitely gives that listener permission to say it's okay to say no. Saying no to one thing means saying yes to another. And if saying yes to your true happiness, which money won't buy, things won't buy, if you are saying yes to your true happiness, you can't put a price on that.
And I love too how you just give the examples of like, if money is keeping you in a toxic situation where you're not, you know, performing at the level that you would like to or doing the things that you want to in your career. I mean, it's your legacy, it's your life. You get a cheaper house. Stop doing that job. Find somewhere that maybe is in a lower cost of living area, or, you know, find a job that, maybe you're not going to be on call at nights or on weekends or holidays, and you take a pay cut, but you don't sacrifice your life. I mean, that it might be as simple as that to help someone, crawl out of burnout and thrive.
Yeah. I mean, I'm saying this not in a judgmental way.
Yeah.
Okay. I've cut back because I truly was not happy in 2016. I was consumed by work, and it's when my mom had a big stroke that left her unable to read, write. She really needed 24/7 care. And so I chose to step up. I didn't have to, I chose because, hey, that's what family does, right?
Yeah.
And I'm an only child. So, of course, I'm going to step up to take care of my mom. But it was that event that really was a catalyst for going from a comprehensivist or a traditionalist in a small town to working outpatient only at another facility. And if I had to do that again, I would do it without even thinking. Why? Because I was able to put my family first. Um, for me, you can't pay me a certain amount. You can't pay me any amount to forsake that. But that's me because those are my core values. I further cut back after 2020 or in 2020 because again, small kids, wanting more time with family, those young years go by so quickly. And as they get older, if I want to increase my work, I can, but I chose. So I had my reasons that spurred me to choose that. But, 10 years ago, I can't say that my insight was there. So it was like they were life events that shifted me to make those choices. Otherwise, I think I would pigeonhole myself into that. I couldn't cut it. But the truth is, now that we're actually talking about we're having this conversation now because it's socially acceptable.
Yeah. It's definitely okay now, right?
It is.
Yeah.
But had it not become okay at some point, I do wonder if I would continue to, and regardless of the statistics, regardless of the statistics I read, because there's always that I'm that doubting Thomas, right? Okay, well, where do I fit into these statistics? And without these conversations, let me just put it this way, these conversations take a lot of the guesswork out for me.
And it's so good to talk about these things, especially for our colleagues who are just, finishing medical school, starting residency, starting their first job as an attending. I know I made a lot of mistakes that got me trapped into a money pit.
Mhm.
Like, you get out of fellowship. I mean, I was in fellowship. I did, an internship, a residency, and a fellowship. And all I wanted to do was buy my dream house and drive the cars and, have the big job. And, you pay for that. And it really keeps you strapped into a position that maybe it's not right for you. It's not the right fit, but you have to continue, or you feel that you have to continue to support a certain type of lifestyle. And once you leave those thoughts behind and say, you know what, actually, I could totally do something different, as a primary position in medicine, and, everything would still fall into place, but, maybe I need to rein it in on spending to have that happiness, because, the money can't always buy you happiness and peace.
Exactly.
Mhm.
But that's what we're trained to think. And, well, not trained to think, I should say, medical school is very expensive and we delay gratification. And at some point you get tired of, living like a student or a resident. I get it.
Mhm.
Um, but at the same time, it's looking at what what's going to get you excited about waking up in the morning. If it's
Mhm.
going to be, we're just talking about fishing. If it's
Mhm.
going, you know, salmon fishing, or if it's going horseback riding, and if it's spending time with your kids, goofing off, like that's what gets me up out of bed in the morning. Is as much as I sometimes some mornings are better than others, but getting them ready for school, I I love it because that's time with my kids, and putting them to bed, that's time with my kids, and for me that's really important to have that time. I For me that is not a that's non-negotiable. So what gets you up out of bed and excited? And if it's your job, if it's your career, your profession, fantastic. But if it's not, and you want more of what gets you excited about life, then make that shift, because that's what life is about. It's not about a massive bank account that we can't take with us when we die. We either end up in a coffin that's about the same size. Everybody has about the same size of a plot, pretty much, or we end up cremated and in an urn. So I mean, kind of puts things in perspective. If we could look at that and kind of re-engineer, like reverse engineer our life, and maybe say, again, these are my core values. This is what I would like to have it look like, but maybe I'm not really willing to sacrifice my happiness, my time, my health, because at the end of the day, that's what you are potentially paying with if you're not truly happy. You're giving up something for something tangible, but it's not true happiness. It's not true peace.
Yeah, I mean, I think that talking to our younger colleagues and just like being really honest about what we wish we would have done, and letting them know about our quote unquote failures. Or how we learned, situations we learned from,
Oh yeah.
and, you know, just giving them free advice that might actually help them. I've had some medical students recently, and I've said, you know what, just continue living like a resident, or like continue paying the interest on your student loans if you have them, when you're in training. Um, consider doing things that, could help you get those loans paid off faster, so that you're not, tied, with the golden handcuffs,
Yes.
later in your life. And that, you'll have the freedom to say, guess what? I'm going to do this job because I really align with the, corporation and the morals and character of, whoever it is that you're going to work with or for. Um, and that you can, make a lot of moves in that way that you're not going somewhere because you feel like you have to make a certain amount of money. You can just do what you love.
Couldn't agree with you more. And I have those
Yeah.
same conversations with my med students.
Yes. Yeah. I'm very happy that there are still people that want to go to medical school because I know that I need some people to take care of me as I get older.
Yes, yes, exactly.
It's not
Exactly.
all bad, but here are the things you need to watch out for. And here are the
Exactly.
ways that you can get some help. You can listen to the Worthy Physician podcast and get some good advice.
Try to. Yeah, I try to. These are conversations like I wish we had when I was a medical student and resident. And it's there's hope. I have hope because when I talk to the medical students, they're interested, or these things are being talked about more
Yeah.
in the curriculum, and that's promising.
I think that, making sure that there's always an open door of communication with someone who might be a good peer or mentor, someone for our younger generation of trainees and, colleagues, to know that, there is hope and there are ways to get help. That can be confidential as well. I mean, I think coaching is just, the most wonderful thing out there. I totally believe that my career changed 100% when I realized and found the world of coaching. Um, I can't even imagine where I would be right now without that resource.
Absolutely. And
Mhm.
it's somebody might think, well, why coaching? Well, I mean, the Kansas City Chiefs haven't done this awesome, and it's such a long time. I don't, but the whole point is, we look at professional sports players, we look at singers, we look at writers. I mean, they have coaches. Why are we any different? Why are we any different? And let's let's get out of the mindset of I have to do everything on my own. Let's get out of that silo. And when you make that shift, it's really liberating.
And when you think about what physicians do and what like CEOs of huge multi-million dollar, trillion dollar companies do, I mean, they have coaches and they're making huge $1 million decisions all day, every day. And what is a human life worth? Who are we taking care of? And who's going to take care
Exactly.
of us? We need a coach.
Yes, yes, exactly. So, I mean, let's say our sport is life and we're taking care of other lives. If there's any doubt, get a coach. I mean, I found the insight invaluable. Like for me, it was literally life-changing.
Mhm.
What does that mean? I was able to see my faults. I was able to see my blind spots, and that's the only way that I, as a let's put the physician part away, right? As a human, that's the way I can improve. And then you bring that physician part back in, and you start looking at things through a different lens. And it's just like I'm really thankful, because I can look at things that I would not have looked through those lenses, nor would I have entertained the idea without that insight.
And all of the different paths that a lot of our colleagues have taken in medicine, kind of showing the way to our colleagues who are younger, but saying that there's not just one way to do this. Like I always feel like I have to tell people that, yeah, you have to go through residency, you have to take your boards, you have to do all these things, but do you have to do it all in the stepwise sequence, exactly as you're told that you have to do it? Like, do you have to practice clinical medicine when you're done with the residency? Do you have to do a residency? Like ask yourself all these questions.
Yeah, exactly. I mean, I think probably now more so, there are more non-clinical opportunities for physicians. Remember, after graduating from medical school, you are an MD. If you don't want to practice clinical medicine, so be it. I mean, there are plenty of companies that are looking for physicians.
And it's not less than, and it's still, very valuable profession, to be in, and you're just doing it in a different way.
Exactly.
Mhm.
There's no cookie cutter way. This is why uh, one thing I like I've always loved this architecture. And what does that have to do with medicine? If you think about the most noteworthy buildings, they're not cookie cutter buildings. I mean, Notre Dame, the St. Peter's Basilica, any the Leaning Tower of Pisa, the pyramids at Giza, right? They stand out because number one, they're incredible. But what makes them incredible is also a little bit of their individuality. So that can also apply to humans. We get so caught up in what are others going to think, and quite frankly, the one that we should be thinking of, what do I think of myself? It's not There's no shame in not practicing medicine. I mean, how many people give up their profession or career to raise a family, and there's nothing wrong with that. It doesn't make them any less of a human being. They found something that meant more to them, or they're prioritizing what is important to them, actually. It's probably a better way to say it. So it's about prioritizing what's right for you. And quite frankly, I'm don't worry about what society or what other people say. If they don't pay your bills, then really at the end of the day, their opinion doesn't matter. If they're going to talk, they're going to talk. What other people think about you is really none of your business. What you think about yourself is definitely your business.
I think it's really interesting that as I've progressed in my career and in life and gotten older, I used to really perseverate about what other people thought about me and people pleasing and, all those things. And as I've gotten older, I have started, just really not cared as much
Hmm.
about that and just kind of moved forward with what it was that I wanted to do and what I wanted to achieve in my life without worrying so much about who I was going to displease or maybe make angry or disappoint.
Yeah.
And I don't know if you have ever felt like that, but like, I mean, I wanted to do everything right and please everyone and just really had unreal expectations of myself early in my career. And now I'm just like, yeah, we're not going to please everybody. Like, do you ever notice that in your journey?
Oh, yeah. Mine was actually pretty early on in college, actually. Um, let's just say I chose a state university over an expensive private, and I got some opinions and compared. And I'll tell you, I was not kind to myself. I was not, I was never suicidal. I don't know what that is like. But there was some self-loathing, and it's just like, why? When and I think a lot of it was when I dropped my classes and I took a little bit, I'd always taken the scenic route through things. So I took the scenic route to get to medical school, through medical school, and kind of through my career as well. But those have been the points in life that have taught me the most. And that is where I've gotten the mind shifter outlook of their opinion doesn't matter. And I'm the one that has to pay for my studies. I'm the one that has to pay for my mortgage. And so I'm going to make those decisions based on what I can afford and what speaks true to me. And at the end of the day, I would still make the same decision. What worked for one person didn't work for me, and that's okay. And now there's no just because you don't want to have somebody's opinion, I would say drive the needle of the decision you make, doesn't mean that you have to dislike that person or displace frustration, but it's also honoring your true wants and your true, going back to what do you really need. And the people pleasing at some point becomes maladaptive. And I would say, yeah, as it became maladaptive in 2016 when I couldn't be there for family and something needed to change. So here we are. I think everybody hopefully will wake up in their own time as to not to have to people please, but I've had bumps along the road but that's also where I had the most personal growth.
I know we've talked about a lot of things here today and really just kind of put out some great advice or, ways that we've dealt with burnout or, people pleasing in our careers and, talked about some devastating things as well. Like your friend from medical school. And, um, if you could really just relay anything to our medical community, our colleagues, it would be like the biggest uh, tidbit of advice that you would give to someone who's going through, a rough time in their career in medicine.
Create some space for yourself and sit down to decide what would truly make you happy and be okay with the fact that that answer might change in life because we change in life as well. I mean, I'm not the same as when I was 31 or 21. So just honor that.
That's awesome. Honoring yourself and your thoughts and the fact that you will change in life and your desires will change over time too. And, I think just really making sure that for the listeners, they know how to get in touch with you, can listen to your podcast, The Worthy Physician. And we're going to put a lot of your resources in the show notes so that you can get in touch with Sapna. And, I think the other thing too is that, just making sure that you're always asking yourself, the questions of, am I doing what's really making me happy in life? Is my career going the way that I want it to go? Are there other opportunities out there for me that I could explore? Even if I'm happy right now, what could I look at that might be new, fun, and exciting, to keep me interested in that career. And then the extracurriculars too.
All the
You know,
above.
yeah. Yeah.
Yeah.
Well,
So,
thank you so much. We're going to say something else. I'm sorry.
oh no,
I
was
interrupted.
there, no, I
Yeah.
just, were you asking a question about how to get in touch with me, or are those going to be in the show
Oh
notes? I'm
yeah.
sorry.
Yeah. We'll put everything in the show notes, but also is there any resources that you would put out there for the listeners right now?
Sure. Uh, let me pull up my website.
Sure.
People pleasing about the only ones that I have to people please are my kids. I mean, to an extent, right? But they're so damn cute. At theworthyphysician.com, there's free downloads and resources. I mean, there's some different uh workbooks that you can go through. There's a 21-day self-focused journal. There's a
Oh, I love
balance
that.
balance of the boxes, balancing life, work, play, social, family, and spiritual. There's also embracing personal values and priorities, what is important to me. Um, those are just some things that, I kind of thought through when I was going through my ups and downs, and that helped me make some of my choices.
That is so awesome. And I love that you're so open about it because, it will help other people. I think showing that, you still can be successful through struggle and helping other people, realize what they can do for themselves if they find themselves in similar situations, because it's inevitably going to happen to a lot of people in the medical field.
Yeah. Yeah. And I'll just tell you what, adulting is hard. Life is
Mhm.
hard.
Yeah.
Why? I mean, why are we ashamed of human experience?
Mhm.
That is one thing that is changing, but definitely needs to change a lot faster for our profession.
We're not superhuman and we shouldn't try to be.
No, no. But that's what brings us to these type of conversations, and for me, that rejuvenates my soul. So, thank you.
Thank you so much. And hopefully we'll have some people getting in contact with you and listening to your podcast because it just has so much great wisdom to offer.
Thank you
Thank
very
you.
much.